All right, Dr. Stancil, you work in New York City.
I do.
And you are, how do you describe what you do?
I'm a clinical community psychologist by training. So clinical is what most people know, where sometimes you think of it as laying on a couch. So I do evidence-based treatment, which is just a fancy way of saying whatever the research says works for whatever that particular kind of issue is, right? A person's depressed. Research says that cognitive behavioral therapy is something that will work. So I use that modality. But I'm different in that the community portion of my training means that I don't just look at the individual. I also look at the family system, the community, and the macro system, and how the person environment fit may impact what a person walks in the door with. And then I intervene on every level that the person allows.
And your patients are, what kind of people are coming into your
Absolutely.
office?
So my specialty is, I would call it intergenerational trauma. So generally, it is individuals whose parents have undergone some type of issue. The identified patient is what we call it, comes in the young adult with, it could be anything, failure to launch. It could be kind of not just getting where they want to get to in life. Generally, parents are like, fix my kid. And I'm different in that I say, okay, well, we got to do work with everybody. And we have to look at every system that might be impacting the child.
And what kind of treatments are you using?
I use every treatment that is appropriate within that family. So what that looks like is if I rarely get somebody that is new to therapy. Typically, I'm kind of your therapist. So most of the time, a therapist will make a referral to me and say, hey, this person's doing great, but we just kind of can't get to an outcome. So I'm known for getting outcomes. So if a person's already doing a certain modality, it could be TMS, CBT, DBT, then I integrate. I'm an integrationist. And what that means is that we might bring on CBT, we might bring on a specialty in trauma therapy at the same time. I kind of quarterback what we call the team, which is just a group of independent providers who all will work together. And what we do is we have a pretty clear goal at about 13 weeks. And then I'll work with all of the therapists that might be on it. I also will work with a nanny. I will work with a driver. I will work with a grandmother. Anybody that is willing to give a dose of treatment to the family system, I coach them in order so that health is kind of robust and there's a high dose of treatment.
It seems like family trauma is like everyone's got a story of some sort.
Amen. Myself included. I think most of us get to this work, by good reason is what I would say. And I call it intergenerational trauma. It could be trauma with a little t. It doesn't necessarily have to be with a big T. I tend to treat, I would call families that are like titans of the industry, individuals that are killing it, doing an amazing in their profession. But the thing that makes them really good in their profession is also the thing that makes it difficult for them and their family, and their expectations that are said or unsaid of their children, to be honest with you.
And very often I assume these stories are, the trauma is handed down from generation to generation.
Absolutely.
If you knew what your family if you knew what your parents or your grandparents went through, you'd understand.
Absolutely. And the reasons why we do what we do. So typically we tell stories. And so that story we use out of fear to protect our children. And a lot of times it's adaptive is how it starts, in that there's something happened to grandma or great-grandma or, grandpa. And so they create a narrative around that. And then they teach their child. Their child is usually, honestly, probably really successful because to a degree that story worked. And then times have changed. And, younger people tend to be very psychologically minded and tend to be very open because of the internet and other things of knowing this actually doesn't work for me. I actually want to do something different, or kind of I am different and I don't know why I'm different than my peers. And so when those things come up, typically they've gone to therapy, which is why I say most people don't really find me initially. But when I train other professionals or when I'm consulting with other professionals, typically it is, we've done all this amazing work and yet we can't get there. The the child hasn't moved out or they haven't quite got the job yet, right? And that's because what we're not doing as a field, in my opinion, is which is where I kind of specialize, we're not treating the core issue. And the core issue is the story that the family is passing down, which actually can be limiting.
What made you want to get into this field?
Oh, that's a great question. I got my own kind of story from my family, and I was probably the identified patient, I would say. I was the one that I was in school forever, is what my family would say, for good reason. I mean, I'm pretty accomplished, and I was in school for a long period of time, kind of not achieving what my family would have expected me to achieve within a timeline that they would have expected me to achieve. Went to lots of therapy and kind of was like, I'm different. I'm just not there where people would think I would be. So what does that mean about me? And I gravitated towards psychology, honestly. Knew I wanted to have an advanced degree of some type at some point. But what I also realized was it was important for me to be able to be genuine. And so I was looking for a field where I could help people, to be honest with you, and also understand myself and understand my family. And through a lot of kind of research, I found out that, so what's actually going on is my family has told me these stories that did work and they don't work for me now. And here's an opportunity for me to actually learn something new. And that's really hard, and so now I do that with other people.
How much of dysfunction in somebody is inherited and how much of it is the environment that they grew up in?
Well, we believe it's a little bit of both. So we believe there's a genetic predisposition to whatever it is, anxiety, depression, you name it, frankly, right? And then something happens, meaning it could be that, you've heard all your life, don't trust anybody, or something actually does happen to you. And then from that, there's a translation of genes. And so those genes turn on, and when they turn on, what we believe to be true is then you see a certain symptom cluster. You see that symptom cluster, and then a lot of times people, when you have a lot of protective factors, which could be money, could be intelligence, could be education, et cetera, status, a lot of times that kind of gets you buffered to a certain point. Then when it doesn't work anymore, and those protective factors are kind of like, not quite getting you where your peers are at that time, usually people walk in the door and say, hey, we need some help.
Do you feel like as a society, because you're hearing the whole backstory and what the generational dysfunction is being handed down from each generation, do you feel like as a society we're getting worse or better? You hear some of these old stories and you just think, man, I
think it's complicated, right? I think that there are areas where, like I said, young people are psychologically minded. I think it's very normalized now that, for young people to talk about symptoms, is what we would call them in our field, right? Other people might call it what doesn't work for you, right? People, there's TikToks, whole mental health kind of threads, which I think is beautiful. I think that when the stigma is reduced, and I would love to see psychology like dentistry or working out and exercise. It's just what you do. It's like you're good, you want to be better, right? You don't feel so great, you get a little specialty scaling or something.
It should be.
I would love to see that, so I think we're better in that way when it comes to psychoeducation. I think, we're better when it comes to destigmatizing things. So we're talking about them, whereas great-great-grandma didn't talk about this stuff, just kind of shh, that we don't talk about that. I think in a lot of ways it's worse in that there's more anxiety because there's more comparison. So now, in a good way, you can find your tribe online, meaning that if I'm struggling with this thing, I can look online and social media and can find others, and that's beautiful. But in not so great ways, I can also compare myself to other people, and it may or may not be real, depending on what they put out. So I actually might be doing okay. But I look online and I see that, actually I should have a yacht and a Benz and, and I should be 20 pounds lighter. And now I'm like, wait, what's wrong with me? So, I think it's complicated, and I think we're better in some ways, and other ways I think, we need to have more real, honest conversations.
Social media is a good thing, but it's also a bad thing in a lot of ways too, right?
I agree. I think just like most things in life, it's bittersweet. I think it can be used superpowers for good or evil, and it's how we choose to use it, look at it, and to understand that all of it is not real, or when I say not real, Some of it is what people want you to perceive things are. And so we compare our inside experience to, someone else's outside visualization of what we perceive they want us to perceive their life to be.
Yeah. It seems like every person they have good qualities and they'll have some not so good qualities.
Mm-hmm.
And everyone has this mix of both, and it's hard to just say, oh, this person is just pure evil and that's it.
Absolutely. I think,
Because to some people, like coworkers or other family members, they're great.
Absolutely.
They're an angel.
110%. Like Lemony Snicket has this quote where it's like based something to the effect of like people are like everyone's like in a vinaigrette of confusion, and it's like people aren't horrible or noble. Like we're a little bit of everything. We're like a chef's salad, and I think we are. I think myself included. That like depending on the day and depending on what's going on, right, and depending on the person that's talking to me, I could be amazing and not so great. Depending on the next day and what's going on, etc.
In your family, I mean, tell me how, you don't have to get into the details of your family, but did you go through things on your
100%. Absolutely. I think that, when I say I think most helpers come to this work, honestly, what I mean is that we all have a story to tell. And we all want to help. I think we would be in other professions if we didn't want to help.
It's part of the healing, too.
110%. I think that when I think about my own family, I think of a resilient people who, I'm a little girl from Georgia, who wound up on Madison Avenue, through grit and hard work. But I also have educational privilege. I have intellectual privilege, right? Like certain doors were open to me, right? Why were those doors open to me? I think I would be remiss not to pay attention to the things that protect me from what other people, face, to be honest with you. But my family, I think, well-intentioned, like most families, right? The stories they told, like I said, they didn't necessarily work for me. And I think that maybe what was different is that I noticed I was different. And I had other people in my family to say to me, hey, you know what? You're pretty smart. Why don't you try it this way? And I was willing to be alone. That's something we don't talk about. So when you start to change and when you start to grow, a lot of times you leave your family of origin. A lot of times you leave friends. A lot of times you leave, lovers or people that you care about. The hope is, right, that as you get healthier, that they'll come around and they'll change. And sometimes they do. But there are also other times where you kind of grow into a new family and you have to create that for yourself.
And being able to be alone, I think, is a very important skill that some of us need to develop.
Yeah. Part of the human experience, I think, is that a lot of us tend to want to avoid pain. And what I mean is pain as in emptiness, loneliness, sadness, shame, guilt. The avoidance of that can be adaptive in some ways for short periods of time. But I also find that when you go to drugs and alcohol and other things, sex, and, sex, drugs, rock and roll, anything that is going to fill that void is going to also stop you from growing in a healthy way.
That's what I've seen. Like the people that are smoking everything from pot to the harder drugs, what that does is it kind of numbs the effect of whatever anxiety or depression or whatever anger, whatever you're feeling, and you never really develop into an adult because you're numbing that pain that will eventually turn into growth.
Yeah, because you can't numb just one area, right? It's like kind of when we talk about working out, it's like you can't like target one body part and you're like, oh, I don't like this part of me, right? It's like it doesn't work that way. It's like when you blunt one emotion, you're blunting all the emotions. And then that impacts your ability to mature and to gain wisdom that comes through moving through the pain.
Is that why we see so many adults that are acting like children?
I would say in our society, in part. The other part is we don't always normalize assistance, help. And it doesn't have to be a therapist. I just mean help. I mean that like on a basic level, which is why I'm willing to work with a whole system. Because it's one thing to say, here, fix my child, and not look in the mirror and not want to do the work yourself, to be honest with you. Because that, in my opinion, you get limited growth. You get what I just described, an individual who then has to, on some level, accept loneliness and alienating themselves, right? It is much more robust when a whole family is willing to do work. And that individual can then go right back to their family system and bloom where they were planted initially. And I don't mean major changes, I'll be honest with you. I mean just tweaks to like, I was seeing it this way. Maybe there are alternative perspectives to it, right? Like maybe my way is not the only way, or maybe success might look different for this individual, right, than what we would expect success to be. I think when we're able to be more willing and open as families, as communities, what we actually will see is people thrive on a greater level.
And we always, even into our older years, still continue to grow and change and
absolutely
learn, hopefully.
Yeah, one of the things that is kind of heartbreaking is like, older people respond to treatment faster than younger people. And it is because they know they don't have that much time left. Like many people will say that like, when you're 60, you're like, hey, how do I want to live the rest of my life, right? So if you walk in the door or if you accept help, you're actually listening to help. And you have life experience also. Your brain is also myelinated in a way where you're more mature, right? Let's be honest. But we don't always think of older people going to therapy. We don't always think of older people getting that kind of help. We kind of write them off in Western society, which is unfortunate, But when those people walk in the door and young adults, like a system also is willing to do the work, I see miracles happen. I curse breaking, generational patterns change so that the next generation actually can thrive and actually have the benefits of everything that the family worked for.
That's the idea.
Yeah.
That's great. What role do SSRIs or other psych medications play in your office?
They play everything. So if a person walks in and they say, initially as a psychologist, I go to talking therapies. So let's talk about it, right? I will see very quickly, honestly, because I'm all about outcomes. So I'm all about, and what that means is I'm applied intervention. So you could there are different modalities where you could spend lots of years, and it's appropriate in therapy, talking about why you are who you are, right? Parents, et cetera. I think that it's useful for a certain demographic, a certain, high intelligence, doing well in life in many respects, but really kind of layers to an onion. You want to understand yourself. There are other people who walk in the door and they're in pain and they're in distress. And in those situations, I'm about action because they think that they've already been suffering and they've already lost so much. So when those people walk in the door, we start with the evidence base. All right, so what therapy is most appropriate? I also look at demographics, right? So money, every intersectionality, sex, race, creed, religion, all these things, right? We together collaboratively pick like, okay, this is what we think is going to work. We try that. If within a couple of weeks the person's not gaining outcomes, then we start to discuss alternative or augments to therapy, which would be SSRIs, first-line treatment. So any type of psychopharmacology, anything that changes brain chemistry while I'm also working on your mind. If a person says up front, I've tried lots of things and they don't work, or I don't want to take medication, there are second-line treatments. That just means that, like, not where we say the science is, like we know works most of the time, but then we bring in other modalities. So I'm very open to some people, on some level, medical-grade food, supplements, to be honest with you, can do a world of difference in certain, if they're open and they're willing to work with a professional that's their area of expertise alongside me. I talked about TMS, neuromodulation, anything that we saw, I would say not snake oil, but anything that we know there is, some research to show there can be outcomes in this. I'm like, hey, let's try it. And we put them together. And if we're rolling in the right direction and it works for that person and that family, I'm here for it.
There's a lot of new treatments that are emerging now.
Yes.
Are there any new ones that we may not know about that are exciting?
Ooh, well, I would assume y'all know what I know, right? I think neuromodulation is really new, meaning that anything that impacts the brain and from an external marker. So I've looked at there's new
like TMS.
Yeah, like TMS. There's also, there's a whole line of different treatments in that kind of vein. I've seen. It's too strong to say miracles, right, to be honest with you. But what I mean by saying miracle is that it's one thing to see a person in pain, let's say OCD, that they have been suffering, or depression, right, and they've tried a lot of things and they don't work. Then to see them go through a series of treatments, let's say 50 is the general kind of what we think of sessions. And at 40, all of a sudden it breaks and they are a different person. Now, you still need therapy because that's kind of like, in some ways, excuse me, but a mind fuck that like yesterday you were suffering and in pain and couldn't get out of bed, or maybe chronically suicidal, or like doing a lot of hand washing. And then today you're like, life is okay. I'm good. So then you also need like assistance to figure out, how do I live my life now? Because when you're in pain, you're surviving, right? It's not about thriving in life and what do you want and where do you see yourself in 5 years, right? People talk about retirement. So there's also help that needs to happen on the other end, which is why I think that all in all, psychology should be more normalized. It's just part of assistance. It's just help, to be honest with you. But I think that when you see someone that has been suffering for a long period of time, they try something new like TMS, and it feels like it breaks. It looks on the outside like a miracle, although we know all the science, and that is really not. But it's a beautiful thing to actually see and be part of.
Yeah, I'm excited because I've had people close to me who have tried TMS, and some of them have had big success. There's an interview on my channel with a girl named Gwendolyn who tried TMS and went from severe depression as a teenager to the cheeriest, most stable 20-something-year-old, early 20s person you've ever seen.
Absolutely.
No drugs, no nothing. She was, I think she was on, psych medications.
Yeah, probably
earlier, but then she weaned off, I think.
Yeah, I think what we don't know, and
I love that it was without medication, without
absolutely.
drugs.
Critics will say, how long does it last? How many doses? And the science is newer in comparison, honestly, to when we talk about first-line treatments, a Prozac, or SSRI, and it works. So part of finding out is understanding the dose, the frequency for that person and how it changes, and then applying that to kind of the masses in a different way. There are articles out. They're all very promising. They're all very exciting, in my opinion. And I think that it's one of those things, like I was saying, it's applied intervention. It's about, let's get in there and let's help this person with not my preconceived notions of what they should be doing, but actually what is going to work for that person.
What makes me uneasy with the SSRIs is it seems like a lot of the doctors are just stabbing in the dark, trying to hope, like, oh, let's see if this works. Let's see if this works.
Deep breath.
Let's take another, change your dosage or do this or do that.
We say it's an art, right? So it's like, we talk about first-line treatments. Let's talk about SSRI. We got to get to certain weeks. Then when we get to that, we know it works, and the side effects are at a certain point, right? Dose, treatment. Then we talk about, let's optimize medication. It takes time, when it works, and it does not work for everyone.
No, it doesn't.
And so something that we don't often talk about is that it does not work for everyone. And so I think, part of doing what works is accepting that for a subset of individuals, these things work very well, and that is why we continue to do them. And then there are other individuals that either they don't work or don't want to try them or don't want to take medication or don't want to spend years in therapy, honestly. Part of what I do when I work with these providers meaning psychiatrists, therapists who specialize in these other areas, is we bring in, and we're all on the same page of, we want to get there as fast as possible with this person, especially a young person, because they're losing the social skills and their, and the camaraderie of peers very, very quickly when they're young. So I think it all comes together when it works really well.
That'll impact them for the rest of their lives.
It will. What we do know is, some of the early career specialists are saying that young people that are behind, delayed like 3 or 4 years, like people who aren't neurotypical, so ADHD, executive dysfunction kind of stuff, they are catching up. We're seeing at about 28 now. And so they look similar. But we also we're talking about people, we're not talking about people who I would say severe depression, like you were talking about the person on your channel. We're talking about people who, and untreated ADHD can cause all kind of depression. Let me be upfront. You show me somebody with ADHD, I'll show you somebody with anxiety. So there's lots of comorbid things that happen at the same time. But even in the catch-up, I would say that they've lost a lot of the peer interaction and support and the social skills that kind of can get them to where they want to be. And when I say that, I'm talking about thriving. I'm talking about feeling happy, out of survival mode, and past kind of the status quo.
What are the complaints that you see most often from your patients? Like, what do they come in for?
That's a good question. Most of the time, what I see they come in for is parents who said, my child needs to come in. which is to fix my child, which I don't do. I say, okay, everybody's got to get a little bit of that.
Children behave their worst. Children behave their absolute worst with their own parents.
Exactly. Yes.
You talk to their friends' parents, and they say, "What a lovely kid you
They
have."
say, "Oh, this is a remarkable child." Yes. And usually, what it is the kids are not getting the grades. Usually, that the parents feel like they should get. It's not necessarily based on. It could be based on history, that they were a certain, like straight A student, and now they're getting C's. Or a student's not showing up. They're not showing up to life, meaning that they're not showing up to a job. They're not showing up, to family events. They're just not showing up into a way that parents are now concerned. They don't necessarily come in, I would say, and say, my kid is depressed. I don't often hear that. What I hear is like, my kid is just not happy. My kid's not doing the things that I think my kid should be doing. Definitely sometimes, especially I'm in New York, so substance abuse, meaning marijuana, a lot of times is decriminalized now. So we are seeing a lot of that. And then that comes into the avoidance that we were talking about before of, not wanting to feel the pain. And so they walk in the door for that. But a lot of times I would say it is, and I don't say this lightly, but shame from the parents that the kid is not doing as well as their friends, peers. And so they want them fixed. And so the kids come in and they're willing because they, like I said about social media, it works as far as the kids are like, oh, I am different. Oh, okay, therapy? It's not like, grandma going to therapy back in the day. Now it's like, okay, yeah, everybody's got a therapist. Sure, I'll come in and I'll talk to you. And so that part is really good. But the kids are usually open. Young people are open to talking. And they'll tell you very quickly, this is what's going on. This is what's wrong. It doesn't take pulling teeth, I find.
It's interesting that we're teaching things like trigonometry and all this advanced stuff in the schools, but getting along with our friends and coworkers and families, just some basic skills should be taught, I think.
I agree.
About how to get along with others, how to love yourself.
I agree. And when I come in to speak, a lot of times organizations will have me come in to talk about just what you're talking about. It's the holidays. There's an uptick usually in therapy, I always say.
Around the holidays?
Absolutely. Because kids are out of school, parents are off work. Like, every time. Summer's a great cure-all. Everybody's fine when they're on the beach, And then when you stick everybody in the house together around, like, dinner, it's like, where's my therapist? Absolutely. So talking to individuals about just interpersonal skills, social skills with family members, conflict resolution when you have different values is a big one, because young people don't often have the same values as their parents and grandparents, and yet how do they then still fit in, with the family of origin and not, alienate themselves, but also be able to talk about their opinion. We don't often have that at the dinner table. It's not part of the conversation that we typically have nowadays.
Is there anyone that's born and raised in a way where they just don't have any of these serious issues that are holding them back? Or
I don't see them.
I grew up assuming everyone was happy and healthy. And then the more I do this project, the more I realize, I don't think anyone's happy and healthy.
You know what?
Well-adjusted.
This is what I say. I say that at some point you will have pain in life, just like you have happiness and joy. And you either, I tell young people who come to see me, you got it early, so we're going to learn a set of skills to help you be resilient, because resiliency is what it's all about. I think at some point, this part of the human experience, you're going to experience pain. And so it's kind of, do you get it early? Do you get it, do you get it later in life? And with young people, I find it, because of where society is right now with social media, they're actually much more open to intervention.
It's really an exciting time where everyone is very open and honest about talking about things.
Yes, in a beautiful way.
In a beautiful way, yeah. I mean, you see it on my channel every day, where someone's talking about some of the most horrific things that we've never, ever talked about before.
Exactly. And I think that reduces stigma.
It feels like there's an interview I'm posting probably next week of a guy named Nick who talks about the sexual trauma that he went through as a kid. And I'm like, man, men didn't talk about that shit.
No.
We just didn't. And here he is talking really intelligently, really openly about it. It was beautiful.
Wow.
And for another guy who's been through the same thing and probably never talked about it, like a lot of men don't, that's got to be so healing.
Yes. No, I agree with you. And for other people watching, to understand that they're not alone. Yeah. I think that's also part of what's helpful with social media is that, to know that I'm not the only person that went through this. Other people are also going through these things. And look, they're actually talking about it in a way that can empower me and empower other people. I think that's the beauty of where we are with the internet these days. 120%, like you.
Yeah, there's always good and bad with everything, and social media, the internet is.
This is true.
Not avoiding that. What's the hardest part of your job?
Grief. So, we call it therapeutic love. But somebody to walk in the door and give you vulnerability on a human level, and you get in there with them and you kind of hold their hand through, sometimes the worst parts of their life, to be honest with you. And their willingness to share that. It takes a care, And even when they do amazing and they leave, right? That's part of the model. It's like you come in and there's grief, because that's the other side of love. It's that, like, you don't get to be part of that part of the story. And you can celebrate that like a graduation, right? And it's also a pain in that's a separation. And sometimes I think that that's what we don't talk about why sometimes people don't walk in the door, is that they haven't had a lot of healed attachment to other people. And it's like, well, do I get close to this person? Will they leave? Will they this? Will they that? I tell people, this is a human relationship. I care. Like, as a person, that's who I am. I'm always going to care, right? And I'm in it with you. We're going to do this together. I'm going to hold your hand as long as you let me. We're going to do every treatment that works. I'm going to find it and scour the earth if I need to. I'm going to be right there with you. And then you're going to go do great things in life, right? And I don't get to be a part of that part of it, Sometimes people send a text and say, oh, I did this, and that's beautiful, But I think that people don't always recognize that, like, helpers care, and that when horrible things are happening, if you look around, there's always helpers. And if you find a helper, they're in it, they care too.
Yeah, and they're healing themselves.
Mm-hmm.
You are doing like sessions like a therapist in your office?
Yep, sometimes.
Do you ever get compassion fatigue?
Absolutely. Yes. Yes. And so I said sometimes, because sometimes families will bring me in when they're already therapists involved, and then I'll basically work with those therapists. But even then, there's compassion fatigue, because it's a lift. It's like you're holding that person in your spirit. You're thinking about that person. Like I said, I'm scouring the earth because they've tried other things and they didn't work, and I know someone's suffering, right? So I'm talking to colleagues and I'm trying to figure it out. And I think it is very hard to know that there's also a limit to what we can do, meaning that I can't work harder than a person for themselves. That can be very difficult as well, to be honest with you. And part of that, I say self-care, but I don't mean self-care and then like go get a facial. What I mean is like appropriate boundaries, meaning that in order to stay in relationship with this person, they've got to do so much work. I've got to do so much work, right? I also mean that, like, I also have to know, am I in a space where I can take on this right now? I have to be kind to myself, just like I'm asking them to be kind to themselves,
Do you find sometimes when you're trying to help a patient that there's self-sabotage going on and they just are resistant to even things that are going to help them?
Absolutely. For many reasons. So it could be our therapeutic alliance. They don't trust me yet. Or there's something about me and our relationship. Maybe it could be just genuine. I said something, my tone, what I had on that day, all those things.
I would think it has nothing to do with you. I would think it has nothing to do with you, but it has more to do with them just not feeling like they deserve to live a better life.
Both.
That's what I see.
Both. Let me tell you why. Because I think that sometimes when you sit high and you look low as providers, what we can do is create distance. And so if I don't come in the room in a human experience, being willing to understand that person's point of view, and also honestly being willing to change an appropriate amount in order to be in relation with that person, that can be off-putting. So I think there's the provider side, there's the my side. I also think there's the person side, where they're afraid of success, they're afraid of failure, they're afraid of what does this mean, they're afraid of getting close, they're afraid of being alone. It's just fear all the way around. And that comes back to epistemic trust, right? That comes back to what they've experienced before, who's betrayed them, did they actually have an appropriate attachment? I think I get a unique opportunity to actually form a genuine human connection with a person and care about them in a way that can be scary. And so part of my job is to understand that about this relationship, that it can be scary. And if this relationship is scary to them, are there things I can do to make it safer? And sometimes it's just about calling out the obvious, in that, like, are you sabotaging? Are you ready for this? Do you need something else before you're ready for a real intervention, right? It's like, should I slow down? I think it's a dance, and I think it goes both ways. And I think to really help a person, you got to be willing to get in the dance with that person.
And Dr. Stancil, what would you say is the most important lesson you've learned in all your years of doing this?
Oh, wow. Yes, great questions. You're pretty good.
I've done 9,000 of these.
I know, right? You're like,
I'm still not that good.
I'm like, wow, okay.
What is
the greatest question that I learned? You know what I've learned? What I've learned is, I would say two things. One thing is, every breath you take, you get the opportunity to make a different choice. And it's not a day. It's not, in my opinion, an hour. It's literally every breath. Every time you take a breath, you get to choose which direction you want to go in, left or right. And so even if you make a mistake, or you're not who you want to be, or you look back and, 2 seconds ago you didn't make the choice you wanted, you get to make a different choice every time you have, the fortunate opportunity that you're still here. And if you're still here, you can turn your life around. Now, that I've seen, I know. And the biggest part of is, I believe it's like, I think pain comes to teach you a lesson. And if we'll surrender to the process of what that lesson is, then what we can do is we can actually catalyze growth, and we can actually be better on the other side of it. I think sometimes we run from pain, we run from negative emotions and how we feel because it's so overwhelming, we think it's going to envelop us. And in those moments, what I would like people to do is to get help. I would like them to get support, and that can be a friend, that can be a pastor, it doesn't even matter. But to have somebody to help hold the weight of whatever that emotional experience is, so they actually can lean into it, and then it can grow, and they don't have to run from it. That's what I've learned.
Wonderful. What a great talk.
Oh, thank you.
Dr. Stancil, thank you so much. Your office is in New York City?
It is in New York City, in Midtown Manhattan.
And we'll leave a link in the description where people can find you. And thank you so much for sharing your thoughts.
Absolutely. Thank you for having me. I appreciate it.
Thank you. When I was designing the first Soft White Underbelly book, I realized that there were so many great portraits that weren't going to make it into that book. They just wouldn't fit. And once I saw how well that first book sold, I knew I'd have to design a second book. This second book is finally ready to ship. Like the first one, this book has a collection of some of the best portraits from Soft White Underbelly, accompanied by a quote from that person's interview. This book features another group of Rebecca portraits, as well as a collection of color images of the Whitaker family, and plenty of others. You can order yours for $125 or $150 for a signed copy at softwhiteunderbelly.org. Again, like the first book, once this book is sold out, I will not be printing more of them. The portraits are what Soft White Underbelly is all about, and these two books contain the best of all that work. Thank you for watching.